Hi everyone, my name is Nicolette, and as you know, I am the founder and president of Gab-Nic Nursing Tutoring Center. I am a nurse practitioner, and what I've decided to do so that I can help myself and those who are planning to go into nurse practitionership or medical school is to go over a few cases with you. These are real cases. I'm leaving out the patient's name and private information so no one can identify them, but I just want to make you aware that these are real patients that I will be discussing and going over so that I can better understand. I just became a nurse practitioner in December, so I'm doing this to help me reinforce the information that I learned in school and get a better knowledge and a better understanding of my workload and what I might be seeing and what I'm going to see and what my other colleagues have seen. So these are real case studies, okay? So if a patient comes in with a chief complaint of shortness of breath, they missed the dialysis, and they have general weakness and general body swelling, okay? That is their chief complaint. Now, for history of the present illness, you have a 47-year-old male with a history of hypertension, polysubstance abuse on methadone. Last dose was this morning. They have dialysis, hemodialysis, Mondays, Wednesdays, and Fridays, and they missed the last two dialysis sessions. And he presents to the emergency room or ED, emergency department, for shortness of breath, requesting hemodialysis. He doesn't have a fever. He's not coughing. There's no hemoptysis, which is bleeding when you cough, and you see it on your tissue. There's no chest pain. There's no vomiting. There's no headache. There's no change in vision. There's no abdominal pain. There's no orthopnea. There is a decrease in exercise tolerance, and he does endorse that it's getting, he has some pain in his lower extremity and it is worsening. So what is the history, the past medical history that we have on this patient? This patient is bipolar, has some bipolar disorder. He has congestive heart failure. He has depression. He has hypertension. He has kidney disease. He has post-traumatic stress disorder. He has schizoaffective disorder. He has seizures, and he has had a traumatic brain injury. His past surgical history is brain surgery. Family history: his mother has diabetes, the mother has hypertension, she had breast cancer, and the father had kidney disease. Social history: we have, we're going to skip that. We're going to go straight to the review of systems. So with the review of systems, we have negative for chills and diaphoresis and fever for the constitution. For HENT, we have negative for nose bleeding and trouble swallowing. Eyes, negative for photophobia, negative for pain and visual disturbances. Respiratory, we have positive, right, for shortness of breath. That's what the person says. Remember, the system review is what the patient is telling you, right? We also have negative for coughing under the respiratory assessment, and chest tightness and wheezing. We don't have that. For the cardiovascular, we have positive for leg swelling, negative for chest pain and palpitations. Actually, I think we had chest pain. I think this person made an error here, because I feel like I remember them saying there is chest pain. No, there is no chest pain. There was shortness of breath. Sorry about that. So they're right. There is no chest pain. There is no wheezing. All right. So sorry. We're still in cardio. So no chest pain and no palpitations. For gastrointestinal, we have negative for abdominal distension, negative for abdominal pain, negative for blood and stool, negative for nausea and vomiting. For genitourinary, we have negative for dysuria and flank pain. For the musculoskeletal, we have negative for joint swelling or malaise and neck pain. For the skin, we have negative for color change. For neurological, we have negative for dizziness or syncope, negative for facial asymmetry, negative for speech difficulty, negative for weakness, negative for lightheadedness and headaches. For psychiatric behavioral, we have negative for agitation. Now, all of this was review of systems. Now, we are going to do the physical exam. Now, what are you going to physically see and assess tangibly? So the Constitution, she is oriented to person, place, and time, right? She appears well developed. This person, they say she, but it's a he. He appears not ill, right? With head and HENT, we have head, Norse cephalic, and atraumatic. Mouth and throat is oropharynx is clear and moist, no oropharyngeal exudate or posterior oropharyngeal edema. Eyes are normal, EOM is normal. Pinpoint bilateral, that's one thing that was noted. We have the neck, which is normal range of motion. Neck is supple, no jugular vein distension, no tracheal deviation is present, and no thyromegaly present. For cardiovascular, we have normal rate, regular rhythm, normal heart sounds, and initial distal pulses. There's no more murmur heard. For pulmonary and chest, we have effort, normal breath and sounds are normal, no respiratory distress. He exhibits no mass, no tenderness, no bone tenderness, no lacerations, no crepitus, no edema, and no swelling. For abdominal, we have soft bowel sounds are normal. He exhibits no distension, there is no tenderness, there is no guarding. For musculoskeletal, there is normal range of motion. Right leg, now we have, he has exhibited edema in the right leg, but it's not tender. And in the left leg, there's also edema, but it's also non-tender. For we have dialysis access that we see is noted in the right upper chest wall, but there's no erythema or drainage. Neurological, he is alert and oriented to person, place, and time. For skin, the skin is warm. Capillary fills take less than 2 seconds, and no erythema. Okay, so now medication. So this person was previously on vitamin C, right? One tablet, 250 milligrams daily. They were on aspirin. They were taking the 81 milligram by mouth. They were on calcium acetate. They were taking one tablet, 667 milligrams total, 3 by mouth, 3 times a day with meals. They were on calcitril, which was 0.5 mcg's capsule. They were taking one capsule by mouth daily. They were on clonidine. They were taking one tablet for 3 times a day. The clonidine was 0.3 milligrams. They were on Depakote. They were taking 4 capsules by mouth every 12 hours. The Depakote was 125 milligrams. They were on hydralazine. They were taking one tablet, 100 milligrams total by mouth every 8 hours. They were on labetalol. They were taking one tablet, 100 milligrams total, every 12 hours. They were on lisinopril, 10 milligram tablet, Q daily, that means once a day. They were on methadone. This was a 10 milligram per ml. They were taking 60 milligram by mouth daily. They were on Norcan, which is, it was one spray, the nasal spray, one nasal route by nasal route as needed for opioid reversal. Repeat with second dose after 1 minute if no response. Okay. So this person, he is allergic to fish, right? There were more. There's simvastatin, 20 milligrams, one tablet by mouth nightly. He was on zinc, sulfate, one capsule by mouth daily. He was on senna, take one tablet by mouth nightly. He was on Veltasas, he was taking 2 packets by mouth daily. Okay, now we go to the allergies. This person is allergic to fish. He is allergic to Haldol. He is allergic to buprenorphine. Okay, so when he takes fish, he he swells up, and the other two, there's no indication of what happens. Okay, the vital signs were 171 over 116. The pulse was 85. The temperature was 97.6. Respiration was 22. And those are the vitals. Now, for the assessment and plan. So, again, we have this 47-year-old male, right, who came to the hospital because they had elevation, or they were evaluated for shortness of breath in the setting of missed dialysis. So they were febrile, vitals and exams were documented, right? So what are we going to do? Okay, so they did an EKG and it showed NSR with VR 80 beats per minute. There was no peaked T waves or sine waves. T waves eversion in the second, third, and fifth. It says AVF and VS, unchanged from prior. So hepatitis lab done on last emergency visit. Plan for chest X-ray, base labs, renal consult for possible hemodialysis, and reassess for disposition. So basically, they're going to do a chest X-ray to see why he cannot breathe. Right? Is his lungs filled with fluid, which it probably is. They're going to do the basic labs to see what he's dealing with, and the renal consult to make sure that he gets dialyzed. And that right there is our first case study. Okay, so I will see you guys next time for our next case study. Hopefully this was helpful. See you guys. Bye.